Once again, good afternoon, good evening. This is Andrew Woods on behalf of Everbridge, and welcome to the Zika virus and emergency management panel discussion today. We are going to be starting the event now, so please, without further ado, we shall start. So the agenda for today's session is we will be having an introduction to our panelists. We will then be receiving some Zika medical information. We will follow that with a panel discussion, and then we'll have an audience question and answer session. We will give you plenty of notice when the question and answer session starts, so please do use the questions box in your GoToWebinar panel, and please post us up anything that you think may be of relevance or you think that you'd like to ask us, and we will be happy to include those. This session is planned to run for approximately 1 hour. So first of all, I'd like to start with panelist introductions. I myself am the host of today, and I'm Andrew Woods. I've worked in business continuity since 2004, and I have deployed global business continuity and resiliency into large organizations. I've managed an Everbridge suite of over 150,000 users in over 100, with hundreds of lines of businesses and in 67 countries. Charlie, would you like to introduce yourself, please?
I'm Charlie Maclean-Bristol. I am Director of PlanB Consulting, so we're a consultancy based in Glasgow. And just all this talk of mosquitoes, I just got back from Oman this morning, and my mosquito bites are starting to get a bit itchy. So actually, I'm sure if I disappear, it's because I'm itching my bites there. So we do consultancy throughout the UK, and about 20% of our work is worldwide. I am a director of business continuity training, does BC training, and I write a blog. And I wrote a blog on Zika and was thus volunteered by the BCI to share in this webinar panel today.
Thank you very much, Charlie. And we'd also like to hear from Dr. James Logan, please.
So I'm a senior lecturer in medical entomology at the London School of Hygiene and Tropical Medicine, where I teach students about diseases including Zika and other mosquito-borne diseases, and I run a research group to try and develop better ways to control diseases that are transmitted by insects. I'm also the director of ArcTech, which is the commercial arm of the school, where we provide consultancy and development and efficacy testing of vector control products, including repellents and afterbite treatments and head lice products and things like that.
Thank you, Dr. Logan. So without further delay, what I'd like to do is move on to our main part of our presentation, which will be the Zika medical information. So take it away, Dr. Logan.
Okay, thanks very much, Andrew. So what I'm going to do is give you a bit of background to the Zika virus and the symptoms. I'm also going to be talking about where the Zika virus is currently prevalent. I'll go into a little bit of the history, and then we'll talk a bit about the vectors. And you can see one of the vectors on this first slide here. This is a mosquito actually feeding on my arm, full of my blood. So we'll talk a bit about what is being done to control these, how do we protect ourselves against these mosquitoes, and indeed what the future holds as well. So just see if I can move on to the next slide. So just to give you a bit of an introduction, Zika virus is what we call a flavivirus. It is very similar to other viruses that we see transmitted by mosquitoes, including yellow fever and dengue fever. It's transmitted mainly by mosquitoes of the genus Aedes. That's a group of mosquitoes called Aedes, and I'll tell you a bit more about them in just a few minutes. Those mosquitoes also carry dengue, yellow fever, and a disease called chikungunya, which is nothing to do with chickens, but it is a virus very similar to dengue and Zika. We now know that some sexual transmission also occurs. And the symptoms of Zika tend to be actually quite mild. In fact, in around 80% of people there are no symptoms at all, but when symptoms do occur, they tend to be mild. They include a rash, some itching, a fever, muscle pain, and conjunctivitis red around the eyes. And I'll show you some pictures of that in just a second. The main problem with Zika is that there are two conditions that are strongly suspected of being associated with Zika, and they are pretty worrying. One is microcephaly and the other is Guillain-Barré syndrome. And I've gone too far in my slides. So in terms of symptoms, the first picture that you can see on the top left here is a picture of a baby who has been born with microcephaly. You can see that the head is much smaller than you would expect, and that is because the brain has not developed properly. So the head itself has not grown to the size that it should be. Babies that are born with microcephaly tend to be on a scale, so you can have very severe cases or you can have very mild cases. And in very severe cases, the babies are completely debilitated. It can affect cognitive function, it can affect eyesight, hearing, and all sorts of things. So it's a really big problem. As I said, only 20% of people will actually develop the symptoms. Because the babies are the problem in the microcephaly, the high-risk group really are pregnant women, and the risk is to the unborn child. You can see on the right-hand side there is a picture of an eye with conjunctivitis, so this sort of red appearance of the eye, and then this characteristic rash that you also get with many viruses, but with the Zika virus, this is a type of rash that you would see. There is also growing evidence now that Guillain-Barré syndrome is linked to the Zika virus as well. And this is worrying because Guillain-Barré syndrome, again, can be very debilitating and can affect adults. And it tends to affect adult males more than females. And this can result in hospitalization and a very sort of slow recovery process, but you can recover from Guillain-Barré syndrome. In terms of distribution of the disease itself, this is the latest map from the WHO, and you can see that the distribution is of the current outbreak is in the South American and Central American regions. You can also see some areas of the Pacific Islands and also the Caribbean, and this is where we're seeing active transmission of the disease at the moment, and we will likely see that map beginning to grow over the next few months into other regions as well. In terms of travel recommendations, there is no vaccine or preventative drug for Zika. And the recommendations tend to sort of, in these types of outbreak situations, tend to evolve. But at the moment, the recommendations are that really, the recommendations are to women and particularly to pregnant women. So if you are pregnant, the recommendation is to not travel to regions of high risk, or if you are planning to become pregnant. It's also obviously very important that we understand that Zika can be transmitted sexually, so it has been found in high concentrations in semen, and so it's very important also if you're a man traveling to a high-risk area, what the advice is that a condom is used for 28 days after return or for 6 months after you have actually confirmed Zika. The reality is we don't know how long it lasts, but because we know that the virus will be cleared by the body within a couple of weeks, then we feel that 28 days is an appropriate time to recommend. Really what you can do to protect against Zika actively is to protect yourself against the mosquito bites. And we'll go into a bit more detail later on in the presentation in terms of how you can actually do that effectively. But before we talk about that, we'll just go through the history very briefly. So Zika itself was first isolated back in the 1940s from monkeys in the Zika forest of Uganda. So it's been around, or we know it's been around for quite a while, and I'm sure it's been around for a lot longer than that. In 1948, it was isolated from a species of mosquito called Aedes africanus in the Zika forest, so then we made the link with it being transmitted by mosquitoes. And then from 1954 to 2007, there were various cases of Zika virus from humans in both Africa and Asia. So it has been circulating in Africa and Asia for some time, and it is still there. In 2007, the virus was found in Yap Island in the South Pacific. 2013, it spread to French Polynesia, the Cook Islands, and Easter Island. And then in 2015, we saw it appear in Central and South America. An alert was raised in 2015 in May, and the virus was considered to be endemic in Brazil and starting to spread to other South American countries. In January 2016, the CDC issued a travel warning, and in February, the World Health Organization declared Zika as an international public health emergency. By February the 2nd, we had evidence that the disease was also transmitted sexually. So that is the history line of the Zika virus to date. Now, just to tell you about the nasty bitey things that transmit the disease, so they are of the group Aedes. The main vector is Aedes aegypti that you can see on the left, but there is another vector called Aedes albopictus, or also known as the Asian tiger mosquito. And I'll tell you a little bit about those two mosquitoes in a bit more detail. So Aedes aegypti is characterized by these black and white stripy legs. I actually think they're quite beautiful mosquitoes, but I'm probably a bit odd in that respect. But they have a nasty bite. They're incredibly aggressive. They'll even bite you through clothing, and that's worth noting when you're trying to protect yourselves against mosquito-borne diseases. They are highly adapted to the urban environment, so they have evolved to be able to live in and around the urban environment. One thing that's very important to know about these mosquitoes is that they bite during the day, and they will bite at night, but they do bite during the day, and a lot of people don't realize that mosquitoes can bite during the day. They will also bite indoors as well as outdoors. So it's important to make sure that you're protected at all times and in all places. They will also take multiple blood meals, which means they will feed on more than one person, which helps the transmission of the disease, and they tend not to fly very far. So households in countries with Aedes mosquitoes can do things to protect their household just simply by, for example, emptying out containers where mosquitoes might breed. And because they don't fly far, that can actually have quite a big effect on the mosquito populations around the house. Now, when we look at the distribution of the Aedes aegypti mosquito, it is quite widely spread across the tropics around the world, and you can see here in the sort of orange and red color, this is where we see the Aedes aegypti mosquito, so in sub-Saharan Africa, Southeast Asia, Northern Australia, lots of them obviously in South America, and extending up as far as Florida and some of the southern states, and into California as well. Aedes albopictus, on the other hand, is less adapted to the urban environment. It tends to be involved in the sort of animal transmission cycle of the disease. Aedes albopictus tend to be less aggressive, and they tend to be found in smaller populations as well. So we don't think they are the main vector of Zika, but they're more than likely involved. One thing about this insect is that it is cold hardy, so it can survive in temperate regions, it can survive cold temperatures very well, and that's a very important thing to be aware of, particularly in Europe, because it probably is only a matter of time before we see that mosquito coming over to Europe. My screen seems to have frozen, so I wonder if Andrew could perhaps move on to the next slide, please. Thank you. So Aedes albopictus distribution, as you can see, again, it's quite similar to Aedes aegypti across the tropics, but you can see now that it starts to expand and extend into parts of Europe. So Aedes albopictus have established already in Italy, in parts of Spain and Portugal, and even in France as well. And it is only a matter of time, probably, until we see it coming over to the UK. You can also see that the disease, the Aedes albopictus mosquitoes expand much further north into North America as well. What's important to note about these mosquitoes, obviously, is that not every mosquito is carrying the disease. The disease has to be picked up from a human and then transmitted from that mosquito to another human. So we have to be aware of the potential places that the virus could end up in the world. So we are on the lookout for it in other places. The Zika virus itself has been isolated from different groups of mosquitoes. We tend to separate mosquitoes into three groups: the Anopheles group, which are malaria mosquitoes; the Aedes group for dengue, chikungunya, yellow fever, and Zika; and the Culex group that tend to be nuisance biters, but they also transmit filariasis and West Nile virus. And they look slightly different. As well, as you can see here, the virus, the Zika virus, has been isolated from all three groups of mosquitoes, but just because it's been isolated doesn't mean that they all transmit it. At the moment, what we know is that the A mosquito group is the group of mosquitoes that transmits the disease. So now just to talk to you about what control measures are actually being done. So how do we actually stop these mosquitoes from biting us? When it comes to community programs in countries where the Zika virus is a problem, and dengue fever and those sorts of things, we have a method where we can target the adult mosquitoes, and that is by fogging or residual spraying of insecticides. And you can see this chap here who is fogging around an apartment block. So this big cloud that you can see is a cloud of insecticides which should kill the mosquitoes. The reality is that this type of method tends not to work very well. It doesn't last very long. Mosquitoes surrounding population can invade or re-invade, and we have one of the biggest problems that we have in controlling insects that spread disease is the development of resistance. So mosquitoes can evolve to overcome the toxic chemicals very, very quickly, and that renders this method not very good. And quite often it's done as a PR exercise to show that the government is actually doing something, but in reality it's probably not doing very much. What we can also do is target the larvae. So in the early stages of life, mosquitoes are aquatic. They live in any sort of water bodies. And we can apply insecticides like Temifos, but again, we're starting to see resistance to those toxic chemicals. We can use a bacteria called BTI or another type of chemical that stops the mosquito from growing called pyriproxyfen. And there is no resistance to those at the moment. There has been some debate in the media about the safety of pyriproxyfen, but those comments really are unfounded, and if used at the appropriate levels, these approaches are safe. One other effective way to reduce the population is to reduce the number of places the mosquitoes can actually lay their eggs. Now, this sounds like quite an easy task. However, when you look at the types of places that these mosquitoes lay their eggs, you can see it is no easy task. So mosquitoes like Aedes will breed in pretty much anything, in plant pots, in used tires, and in fact the reason that these mosquitoes have spread around the world so rapidly is mainly, we think, due to used tires. There's a very big trade in used tires and they get shipped around the world, and they create a fantastic place to hold water and for mosquitoes to breed in. You can also see cemeteries in South America, a place where they and even the rooftops of houses can hold mosquito populations as well. So it's a very, very difficult task to control the larvae by getting rid of the breeding sites. If we've travelled abroad, we've probably used a bed net at some point, or screens on the doors or windows to keep the biting flies out. This is the way that we control malaria, and we have managed to reduce malaria transmission down to around 500,000 from about 1 million over the last few years through the use of insecticide-treated bed nets, so they do work very well. The reason they work well for malaria is because the mosquitoes that spread malaria bite at night. The Zika vectors bite during the day, and they will bite outdoors. So we tend to think that bed nets are not a good idea for Zika. However, many people will sleep during the day. In the afternoon, they'll take a siesta. Many people will work night shift. Also, babies will sleep during the day. Some people will just sleep in or go to bed early. And so it is still important that in these regions people use bed nets. So bed nets should still be recommended in areas with Zika. Another thing that many people will be very familiar with is the use of insect repellents. Repellents are what are considered to be first in the line of defense against mosquitoes. They are highly recommended. In fact, in South America, they are being given out by the government to pregnant women to protect them against mosquitoes that spread the Zika virus. It's a potentially confusing world when it comes to choosing which repellent you should use when you're traveling. We run a campaign called the Bug Off campaign, which will be launched in June this year, and the aim of that is to educate people on what to use and how to stay safe while traveling abroad. The basic rule is that there are 4 active ingredients that you should look out for when choosing a repellent. The first active ingredient is DEET. It is a synthetic repellent. It was discovered back in the 1940s by the US military. It is the best and most widely used repellent on the market. The concentration that you should use it in should be between 20 to 50%. You shouldn't ever have to go above 50%. You can buy 100% DEET, but the reality is that it doesn't do anything better than a 50% product. All you're doing by increasing the concentration is increasing the length of time that the product lasts for. When you apply a repellent, it's very important that you apply it like a suntan lotion. If you miss a bit, the mosquito will find it and they'll bite you there. So DEET is very good. It is what we would recommend for pregnant women because we have evidence from trials that pregnant women are unaffected by DEET and that the unborn child or children that are followed up years afterwards are also unaffected by the use of DEET. There's a bit of controversy around the use of DEET. A lot of people tend not to like to use it because they think it's unsafe, because it melts plastics. One thing to bear in mind is that we are not made of plastic, so it doesn't melt us. We also have shown in a report that we published last year that the safety concerns for DEET are pretty unfounded. There were 13 cases of seizures back in the 1980s in children, but there have been no real reports of any serious adverse effects except inhalation or swallowing DEET. So as long as it's used safely and used according to the label,
so you go in the door, the side door
is safe to use. The second active ingredient is PMD or p-menthine diol, which is a natural repellent from lemon eucalyptus. This does work very well, but it is less effective than DEET in that it doesn't last as long as DEET. So it will still repel very effectively, but you have to reapply it more frequently. Then there are 2 other active ingredients, Icaridin and IR3535. These are synthetic repellents and they also work, but again they have to be reapplied more frequently than DEET. So if you're going to a high-risk area, then DEET is the repellent that you must use. Some airlines now are being recommended to spray. I'm sure if you've been abroad, you've probably been in the situation where the cabin crew have walked down the aisle spraying cans of insecticide, which is a bit disconcerting for some people, but it is safe to do this. However, there is actually very little evidence that this does anything whatsoever, despite the fact that governments are recommending that this is done. So further trials are needed really to see whether this is even worthwhile doing. But it is an added way potentially to reduce the number of mosquitoes being transported across the world, but also protecting travelers inside the aircraft cabin if a mosquito was to enter and was infected in the cabin. So there are many methods that we can use to target the mosquitoes that transmit the disease, as you can see. There is actually very little evidence that these methods can reduce disease transmission, but what we do know is that they can protect you against mosquito bites, so they absolutely must be used. We've got many challenges when it comes to actually tackling the disease itself in disease endemic countries, and more studies are certainly needed, but certainly there are lots of ways that we can protect ourselves, particularly when we're traveling to these countries. Again, in the press, there's been a lot of noise about genetically modified mosquitoes, and GM mosquitoes were developed by a company called Oxitec in Oxford. What they do is they insert a gene into the male mosquitoes. The male mosquitoes are released into the wild. They mate with female mosquitoes. Female mosquitoes will only mate once. They store the sperm. When they lay eggs, the eggs will hatch, but they will not develop into adults. So the mosquitoes cannot emerge as adults and therefore cannot transmit the disease. Now, many trials have been done in various different regions and have shown very good efficacy. So they've shown above 90% reduction in mosquito populations using this method. The press have sort of been showing this as the sort of solution to the Zika virus. It may well be a solution in the future, but it's not a solution for today. We're not quite there yet with that research. GM mosquitoes are safe and they're very effective, but more work is needed before that can actually be rolled out. So we have to rely on the methods that we talked about previously. There is another way that we can do this, and this is through what we call Warback. Warback is a bacteria that lives inside insect cells. It's not found in Aedes mosquitoes, but when you put it into Aedes mosquitoes, it actually inhibits the virus from replicating. It stops the virus from multiplying inside the mosquito and therefore reduces the transmission. Again, this is an excellent opportunity for this new technology to be tried in these countries, but it's not quite there yet. It's not quite the solution that we need quite yet. We probably all know, if we've been on holiday, that some of us will get bitten more than others by mosquitoes. This is a real phenomenon. This is something we've been studying in my lab for some time, and you can see on this graph that on the left-hand side we have some volunteers who are extremely attractive to mosquitoes, and on the right-hand side, some volunteers who are extremely unattractive to mosquitoes. In fact, some of these people are no more attractive than a control of clean air. This is a real phenomenon, and we have been investigating this, and what we found was that people who don't attract mosquitoes are actually producing natural repellents. So it's almost as if our body has developed a natural defense system against mosquitoes. Now, we're going on to create new products based on these repellent chemicals produced by humans, and those products should be available sometime soon. But in the meantime, it's worth noting that some people do get bitten more than others. Even if you think you're unattractive to mosquitoes, though, you must still use repellents and still protect yourselves. We think that around 10% of the population are unattractive to mosquitoes, but we've never actually looked at this in disease endemic countries. It could be that people have evolved in those countries to become less attractive to mosquitoes, but we don't know whether that's happening. What we do know with other mosquito species is that pregnant women are more attractive, and this has been shown with malaria mosquitoes. We don't know whether it's the case with Aedes mosquitoes and the Zika virus, but that's something that we're going to be looking at as well. So women that are pregnant might actually be at more risk, not only from the virus, but also from being bitten by mosquitoes. It may also be the case that the virus itself makes us more attractive to mosquitoes. Again, something that we're looking into, and we found with malaria, but we're going to look into that with Zika hopefully as well. What we've also shown in my lab is that how attractive you are to mosquitoes is controlled genetically. So the level of heritability, so how much it's controlled by our genes, is very high. It's very similar to things like IQ, eye color, and height. So it's very strongly controlled genetically, and we will be investigating that further in the context of Zika in my lab. What we need to do next is identify the genes associated with how attractive you are to mosquitoes. And if we can do that, we can develop a drug, a pill that you might take when you go on holiday that would cause the body to produce natural repellents and create this sort of aura of repellency to keep the mosquitoes away and minimize the need for the use of topically applied repellents. Now this could completely revolutionize the way we travel and how we protect ourselves against diseases like Zika, but we're not quite there yet. So the message really is that when you're traveling abroad, you must use repellent, one which contains DEET or PMD, and you must use it religiously and the other methods we talked about to protect yourselves against mosquitoes that transmit Zika and other diseases. And it's very important to note at this point as well that Zika is a problem. It's got a lot of press interest at the moment, and it is something we should take very seriously. But what's important to note is that there are many other diseases transmitted by mosquitoes, including malaria, dengue, chikungunya, yellow fever, in many countries around the world. And there probably is a higher risk of you getting something like dengue by traveling to somewhere like Brazil than there is of getting Zika. So what we should bear in mind is that these diseases are there. They have been there for a very long time, and they will continue to be there. So protecting ourselves, regardless of the Zika situation, is very important. And I'll finish my presentation there. Thank you.
Thank you, Dr. Logan. That was very interesting, I have to say. I learnt a few things myself there, and I'm sorry about the background noise. We should have sorted that out now. So before we go into the Q&A session, I just thought I'd give everyone else the opportunity and just remind you that the question panel is there. We had a couple of questions come in already as Dr. Logan was talking, which I'm pleased to see. So the format that we're going to go through now will be, I'll be asking our panelists a series of questions we've got which are topical, and we'll all be contributing on those questions, and then we'll be following up with the questions from the audience. So without further delay, he says, this question here is for both of our panelists. What I'd like to do is I'd like to ask you what your feelings or perspectives are as to the main risks surrounding the Zika virus. So if I can start off with Dr. Logan, that would be great, and then we'll come to Charlie. Thank you.
So, you know, as I said in my presentation, the main risk really is at the moment, is to the unborn child. So the risk is to pregnant women who are traveling, and the risk is that you get this pick up this virus from a mosquito bite, and your baby could then be affected. There is also a risk of Guillain-Barré syndrome, as I said, but we're not as sure about the connection. There seems to be a connection there with Guillain-Barré syndrome, but the level of association is not clear at the moment.
Okay, thank you. And Charlie, what's your perspective on this, on the Zika virus?
Well, it's funny enough this for a sort of business continuity view from sort of the initial bit. You're saying, well, what's the problem? You know, it's not going to affect our business. It's not going to stop our products going out. I think if you look at it a little bit deeper, there is. First of all, I think the business continuity manager's job is to identify new threats and to quantify them to senior managers. So I think our job in this is to, first of all, help people understand it. There was a lot of hysteria around about Ebola, and in the United States they thought one case going in there, everyone was going to die, and actually, as we well know, that's not the case. So I think we need to help educate our staff on what is the threat. But I do think there are some practical things we can put in place with travellers and pregnant.
Something like that, if the colour is.
Sorry,
Okay.
Let me just try and mute that.
You could do it for fun, but
I've got to.
I don't know how. I don't know.
Sorry, I'll just keep going that. Chris, I think that's you talking. Can you mute him?
Yeah.
All right. Okay.
Sorry, I'm just going to keep going then. What else we need to do is to look at also expatriates in the country, how they're dealing with it. So what do we say for people there, what the travellers are there, and also what is our guidance to local staff. I think we need to have a policy on it, a travel policy, and we also need to do some monitoring of the threat.
Yeah, that's a few really good points there, Charlie. I'm just going to pop you on mute while we go to the next question, if that's okay. The other aspect I would probably add to this myself would be that often one of the main concerns that people have around a virus such as Zika, or in fact any other contagious disease, will be simply lack of information and getting the right information. So it's just very important to get the right information out to people. So on to question number 2. What information should you try and share with your employees around Zika, and what should the goal be? So Charlie, if we could start with you, that would be really good. Dr. Logan, would you like to start, actually?
What info should we share with employees around Zika? So, you know, I think really it's important to, as I said, be aware that the risk is generally quite low to most people. I think, you know, business should pretty much continue as normal. I am advising the Team GB for the Olympics, and there's a lot of hysteria around, you know, should we should the athletes be sent out to Brazil because there's probably a risk of them getting Zika. I mean, the reality with this disease really is, for most people, you're not even going to know that you've got it, and it's not going to. So there is no reason to stop normal activities. But you know, the key really, and this is the key to our bug off campaign as well, is to just equip people with the right information and the right tools to be able to minimize the risk when they do travel. Obviously, there are very serious recommendations for people who, and I keep saying this, who are pregnant, obviously for obvious reasons, but otherwise, you know, I think that it should be a case of business as usual in many ways. And I know that, you know, in countries like Brazil and Colombia, they are getting on with things. You know, they have to get on with things, despite the fact that these diseases are here. And this is not the only disease. There's malaria, there's dengue, there's a variety of diseases. So really, we have to crack on, but be aware of the risk and try to minimise that.
Okay, thank you. And Charlie, what's your perspective here?
I think it is the more people understand, I think I'm James with it sort of very measured way there. I think the more we understand what the risk is, you know, it's a lot of the risk of the unknown. If you actually sit down and explain to people and say, actually, you know, if someone of your colleagues just come back from Brazil and had Zika, you are not going to catch it by sitting next to them. So I think it is helping people understand what the threat is and what is the risk. And I think if you sit down and explain to people rationally, I think they'll be quite comfortable with it, because, you know, it's only affecting a very minor part of the population. But I think, you know, because it's a threat to our children, then I think we have to take it very serious, because then people, you know, do anything to protect their children or their unborn children.
Yeah, I think that's an excellent point, which would be, you know, from my perspective, it would be very much sharing the information around on transmission and around employees protecting themselves if they are sent to a location or visit a location which has got the Zika virus. And that includes using things like barrier method contraception, or you know, and basically even sometimes maybe taking a pregnancy test before they go. There's a number of different things you can do around there.
That's right. And also Yeah, and also to you know, what to do when you come back as well. So, you know, as I said in the presentation, in terms of contraception and also looking out for the symptoms, because it, you know, when the mosquito bites you, you don't necessarily get the symptoms straight away. It might be you know, 4 or 5 days later that you start to become ill. So it's knowing that that may occur after you've returned and getting the right help and the right advice if that happens.
I think it's also worth than that having a sort of written policy for your staff, so thinking through some of the scenarios. What happens if you have an expatriate family in Brazil now who are quite happy and then said, well, look, you know, we're just starting to have our third child, we want to come back now. We don't think it's safe to be there. So how do you deal with that? How do you deal with maybe local staff? How do you deal with somebody who doesn't want to go to Brazil and say, oh, it's far too dangerous to me, I'm not going? How do you deal, I think it's another interesting point, is about people's holidays. Do you have any, you know, someone wants to go to Cancun for their holidays, is it part of your job as a business to advise them and say, is that a good idea, or is that people's free time and interfering in it? So I think as organizations we had to take a view and think through how it's going to deal with it, what are some of the consequences and what are some of the issues we may have.
And I think, sorry, just to add to that, I think it's a case of just ensuring that, as you say, by developing policies, but also those policies need to contain links, I guess, to get the right information, because it is equipping people with the right information and allowing them then to make an educated decision as to whether they should travel and how safe it is for them to travel.
That's an excellent point. That's an excellent point, Dr. Logan. Which brings us nicely onto question number 3. What resources do you use for planning and communicating strategies around Zika? So the thing that we use, I guess, as scientists, we have access to data that is not necessarily publicly available. So, you know, we have here at the school, we have a Zika task force, and we meet weekly and we review any new data that's come out. I'm also part of the scientific advisory group for emergencies for the government, and we do the same there. And so there is a new policy in science that allows free and open sharing of data around the world, so that we can all be very well up to date on terms of what's progressing with the Zika virus. But, you know, it's also important to be able to convey that message as effectively as possible. And we do have on our website, on the London School of Hygiene and Tropical Medicine website, we do have an information page on Zika. But the media is a very important outlet as well. And, you know, we're doing our best in terms of communicating as much as possible with the media to try and sort of dampen the myths and the misleading sort of headlines, but also to get the right information across. And actually the media, I think in general, have done a fairly good job actually in terms of communicating things around information around the Zika virus.
I think that's some interesting points there. I think in, you know, my looking around the UK, there's some good information there, and I think, you know, if you can use some reputable sources, as Dr. Logan was saying, I think that's fine. I just think what is interesting is that on Friday I was having lunch with some clients who'd come in from Mexico for a course. And we were talking about Zika viruses, and we were just congratulating one of the guys who said his wife has become pregnant. And I asked him about Zika, and he was saying, oh, no, it's not a threat to us, not a threat to us at all. And I didn't want to press this all, because I didn't want to kind of upset him, because he was very happy about his having his new child. But I was kind of thinking, if it was me, I'd worry more. And I think my point from that story is that I think some of the governments of some of these countries are perhaps putting a different spin on it, because, you know, governments don't want to you know, alarm people, and there's also tourists as well. So I think we've got to be a little bit careful of, you know, listening, almost like listening to multiple sources, and then taking our own advice there.
Yeah, that's really good perspectives there, and I would say lastly on that is it's very, very important to try and counter some of the bad intelligence that is out there. And there is a lot of misleading information. It's very important to always point people, if they are requesting this information, to reliable sources such as your governmental health website, Centre for the Tropical Diseases, the WHO, rather than people reading something in a tabloid newspaper and getting very concerned and scared about it. Which does bring us to the next point, which is, what are the best methods for the public to gather information about Zika? I know, James, you mentioned you have some special scientific resources that you have access to. So I think this one is really for Charlie around, where's the public information that you can go to gather this sort of info?
Well, I think it is just as those sort of public websites there. But I think, from a sort of corporate business continuity manager point of view, I think as corporates we need to take a view on that. We need to be well informed, but we need to take our organisation's view on it. And different organisations have different views of risk. Like Andrew, you worked in a massive organisation with a lot of local staff. They may look at that different to a company that may just be sending the odd person from UK abroad. So I think organisations, as I said earlier, need to take a view on this, getting their information, and then promoting their own company view.
If I could just add to that, if I may, Andrew. As you mentioned, there are government websites. So in the UK, we have Public Health England, and there are constant updates from Public Health England. They are at the forefront of the sort of new data coming in. So they are making the most up-to-date and accurate recommendations. And that is a good resource, and most countries will have an equivalent. Such as, for example, the Centers for Disease Control in the States, or the CDC or the ECDC in Europe. And then there's the World Health Organization as well. And these organizations produce very good, very easy to understand, very clear recommendations and information and fact sheets about things relating to Zika. And indeed, we ourselves, we are working with several organizations to help them to come up with their own materials that they can send out to their own organizations. So for example, we're helping them to develop information for their websites, or for leaflets that are given out to people who travel, and just to be able to get that message across. And I think part of the responsibility of any organization is to be able to give their staff, their employees, the right tools and the right information about something like Zika when they travel.
Yeah, I mean, that's absolutely important. And as Charlie said as well, it is very dependent on your organization's risk profile and how you wish to gather and distribute that information. And it's interesting because the next question we actually had in the deck here, which James has done really well at already answering for us, which is, are there differences between the different countries, especially in Europe, and around how they communicate and how they deal with the threat of Zika? So, James, perhaps you could talk about that.
Yeah, I mean, I think in terms of organisations that send people abroad to travel, I think it's the same for everybody, and we should take heed of the recommendations and the tools available to us. As I showed in the presentation, Aedes albopictus mosquitoes are prevalent in some European countries. At the moment, this isn't an issue, although we do have outbreaks of diseases like dengue in the south of France and in Italy and some countries, so we need to be aware of the vectors, but certainly it's something to look out for. And in the future, we may see small outbreaks of something like Zika in some European countries, and so keeping an eye out for that information, although I'm sure it would hit the headlines very quickly if it did happen, then that's something to to keep an eye on, basically. And regardless of where you are, you should protect yourself against mosquito bites. Not only do they transmit diseases, sometimes in Europe we have leishmaniasis transmitted by sandflies in southern parts of Europe as well. But as well as that, they cause horrible itchy red lumps, and when you scratch those lumps, they can become infected. So it's always a good idea to protect yourselves against mosquito bites, regardless.
Yeah, very much. I would be one of those people that's very attractive to mosquitoes, unfortunately. So I empathise there entirely. Charlie, do you have a perspective here?
I don't think so much here, because I'm not so very familiar with other countries what they've been saying about this. But I think again, if you're a multinational company, you need to take a global view and not just, we're England, we're quite proactive, so we've done something, but our Germany subsidiary hasn't done anything. We need to make sure that we have some joined up, especially for extremely large organizations.
Yeah, and I would absolutely agree with that. And I would also add on to that point that if you are a large organization and you're in one of your regions or countries, you are dealing with this sort of situation or concerns, it's really important to then communicate that up through your organization, because chances are somebody else within your organization may be having that same issue, and it's much better taking a combined approach. And secondly, if you have got employees returning from an area where there has been some kind of infection or outbreak, chances are your senior leadership are probably going to want to know about it. Certainly my personal experience there. So the next question we have: what should employers communicate to employees who are being sent to areas with Zika? So this is about actually employers requesting people go to those areas. Charlie, could you start us off, please?
Yeah, I think with this thing, I think with you're going anywhere abroad, I personally think you ought to do a risk assessment, whether it is medical risk assessment and a security risk assessment. And I think as part of the medical risk assessment, you should be flagging up to say, actually, you're going off to Mexico, this is near rife with Zika. I think before they go, they need to have information of what the threat is there. They ought to take all Dr. Logan's good advice. I would also say that if to give them the advice about if you are pregnant or think you might be pregnant, perhaps take a pregnancy test before you go, and for males to beware of and the precautions to take on the way back. If you think coming back, if you think your wife could be pregnant, or you think you've caught the disease. So I think you've got to be honest with employees, and maybe you've got to be saying, well, say to employees, are you happy with the threat there, and make them aware as part of your duty of care.
Okay, great. And Dr. Logan, what are your thoughts?
I think, to be honest, I would probably just echo that. Really, it's obviously very important. When we send anybody out overseas, and trust me, at the London School of Hygiene and Tropical Medicine, we do that a lot. We always have a risk assessment in place, not mosquito-borne diseases, but for good hygiene and terrorism and all sorts of things. So I think that's very important for staying safe whilst travelling abroad. And I think it is the employer's responsibility to ensure that their staff members are safe, that the adequate insurances are in place, and that people have the right tools, the right information to ensure that they're prepared before they go, so they have the right vaccinations, they have the right antimalarials if they need them, that they have the right repellent and things, bed nets to protect themselves, that they also have the right information to determine what is wrong with them if something does go wrong when they're overseas, and then when they come back, things to look out for as well. Like I was saying, that it does take some time for some of these symptoms to occur. So just to be aware that can be slightly delayed, and to know where to go to get help. And as I say, this is something that we are doing quite a lot just now, is providing this sort of advice to organisations to allow them to provide these materials and tools to be able to educate and inform organisations' employees.
Wonderful. And I would add one last point to that, which is giving employees the option to say, no, I don't want to go, with no consequence. And that can be for any reason that's flagged up, because some employees will be willing to take risks and some employees won't be willing to take risks. And really, you know, having seen it from a global perspective myself, some people can surprise you at the level of risk that they're willing to take, and others maybe not. So really having something in place where people can feel that if they say no, they're not going to be penalised within their role or anything like that is quite important. And we are coming on to the last question now, which is question number 7. We do have a lot of questions, so we'll try and be as quick and get onto those as we possibly can. So the last question is, are there any specific actions, advice or precautions that that are required once you return from an affected area? So Dr. Logan, over to you first.
Sure. Again, you know, as I said in the presentation, because the main risk is to pregnant women, that well, not to travel, but if you do come back and you have symptoms, then obviously go to your GP, or you can visit a tropical disease hospital to get advice. And really it's about monitoring for any symptoms, such as the symptoms that I showed you. I think also, you know, advice needs to be given for women that are pregnant, or for people who are thinking of becoming pregnant, and including men. I think that's possibly something that may be overlooked quite easily, is the fact that this is sexually transmitted, but from, you know, man to woman, and therefore contraception needs to be advised. So again, it's about getting the right information to those people when they return, so that they can take the right precautions.
Wonderful.
The only thing I'd like to just add to that is perhaps the education of the colleagues of the person who's just come back, so that to make sure the whole organisation knows that you know what the threats and risks are, so they're not going to be sort of walk into the office and everyone else disappears and you some of the hideous infected disease that they'll all catch. So I think it's that education of the others as well as the people who are going.
Yes, and that's an absolutely relevant point. It is very important to, you know, reassure people that the chances of them catching Zika off of a colleague are very low, depending on what they get up to, of course.
Yeah.
So on that note, we'll move on to the question and answers. So this will be a sort of similar format, but obviously I'll just be reading or paraphrasing the questions out. The first question, which is a very easy one to answer, is, will there be a copy of this available online? Yes, absolutely. We'll be putting a copy on YouTube that you can go and view within a couple of days. So the next question I've got, and this will be one for Dr. Logan, is the risk the same throughout pregnancy? So
this is a hard one to answer, actually, and when people ask questions about Zika, including when we're sitting in front of government officials, it's very difficult, because we don't know a lot about this disease. We think that the highest risk is probably during the first trimester, but we think the risk, and it probably gets less as you go on and the baby develops, but we don't actually know, is the answer at this stage.
Okay. Well, I like to start off with a nice hard question. So hopefully this one's a little bit easier. Do electrical plug-in anti-mosquito devices work? And that's got to be one for James.
Yes, they can do, but it depends on the product. So if the product is a plug-in that contains an insecticide like transfluthrin, then it can work very well. And what I tend to do is I wouldn't have it on the whole time, but I would have it on for periods of time, because what that chemical will do is it will repel mosquitoes, but it will also kill whatever's in the room. So if you have a room and you've shut the door and you've shut the windows, and no other mosquitoes are going to come in, put it on for a couple of hours, maybe while you go for dinner or whatever, then switch it off before you go to bed, and that should be enough. You do get some electronic devices, such as mobile phone apps and other sort of ultrasonic machines that produce sound to repel mosquitoes, but none of these things work at all. So the plugins tend to be effective, but anything else electronic doesn't work.
Okay, wonderful. We'll just try and get a couple more questions. I know we're running slightly over time, but this one is for Charlie. Should your business continuity plan be connected to your health and safety plan? If so, who should lead that effort?
Well, I think with all these sort of things there are different leads in different organisations. I just got back from Oman, as I said, and I've been working for the quality, health and safety guy, and that's where business continuity lies within their organisation. Whereas different health and safety may be separate from business continuity. I think the whole point about this is, I don't think it's some of those things you suddenly need to go out and let's go and write a business continuity plan in the same way as you'd write a pandemic plan, because I don't think the threat is the same. So I think we need to get a bit of a joined-up conversation in the organisation and go to probably HR, who's responsible for travel security, and have the conversation with them, and then they are the person to maybe front it out. So I think it's our job as business continuity people is to facilitate, help the people with the right information, but then get it as appropriate within the organisation.
Okay, and I think we've got time just for one more question, which will be to both of you gentlemen, please, which is, there are so many diseases out there in the world. How should you raise awareness of this particular one, and is it appropriate to raise awareness of one illness over another so perhaps James, if you could start off with that, please.
It's a very good question, and I have said a few times in this presentation that there are many other diseases which are probably of higher risk and have much more devastating consequences, but I don't think that any disease should be ignored. And this disease has got quite a lot of attention because it's appeared in a place where we haven't seen it before, and there's been a spike, and that's why it's been declared an emergency. It's also a disease that affects babies, and of course that creates a lot of attention because we don't want to see our children ill, and some of the images are quite harrowing, and I'll be honest, have affected me quite significantly, having become a father myself for the first time quite recently. So any disease is important, and I think we should be doing our best to raise awareness of those. But when we have a situation like this where there are a lot of unknowns about a disease such as Zika, then I think we have to be a bit more cautious and provide as much information and advice as possible, because there's always the risk that people become over worried, that the media starts to scaremonger, and so we need to try and contain that, but to a level where people get the message that they should stay safe, but not so much that they then don't travel when they can travel at a low risk.
Great response,
and
Charlie.
I think for me, as a non-medical person, I think it's why it resonates with a lot of people. A, there's no cure. B, it's unknown. And three, I think is the biggest thing. It could affect your children. And I think that gives it a kind of emotional edge over some dengue fever and some of the other things you say which are a bigger risk. But I think that's what gives it the emotional edge. And we've seen those images of the children, and and that's going to affect parents for the rest of their life. So I think that's where the emotional attachment is there, and I think, you know, especially from here, if we can do something to protect people, I think we should be doing something, and that's, you know, part of our job in the business continuity is making sure we identify those risks and to make sure that, you know, if we can present one person getting it, then I think we can take our pay at the end of the week saying actually we've achieved something.
Yeah, Charlie, and I think that's an absolutely brilliant point around, you know, if you're dealing with these multiple risks, it's all very good and well saying, well, we're going to prepare for a particular pandemic or illness, but really we should be thinking about perhaps we actually need to have an overarching pandemic plan that allows us to respond in a measured way to any of these kinds of risks, whether it be H1N1, Ebola, or Zika. Certainly that's an approach I've seen used in multiple organisations very successfully that allows people to be adaptive to these particular scenarios. So
Yes, I do.
I think that's all we've got time for today. There are more questions, but we are running almost 10 minutes over, and I think we need to be respectful of everyone's time here. So what I'd like to say is thanks to our panelists for joining us today. It's been really, really great to have you. I've personally learnt a few things and got some more food for thought, which is great, and I hope you as our audience has as well. So thank you from me, and I'd just like to give Dr. Logan a last couple of words.
Okay. Well, I guess I thank you for asking me to be part of this. It's an important part of my job as a scientist here working on Zika and other diseases to be able to communicate with everybody really about this. So it's been a good opportunity to be able to share my views on this. So thank you.
Thank you. And Charlie, any last words from you, sir?
I think just what I like is what Dr. Logan said. Is I think it's just a brilliant measured response, and I think that if we can adapt that sort of tone with that sort of information and go out to people, say yes, it is a risk, but the risk is this. I think that is good. So I've really enjoyed it, and actually, hopefully, we've all learned from it.
Yes, agreed. Thank you, everybody else, and thank you to Everbridge for allowing us to host this session. Goodbye and have a great day.